Miglustat capsule is used for the long-term treatment of a certain rare genetic problem called Gaucher's disease. It works by decreasing the amount of a certain natural fatty substance called glucosylceramide that builds up due to this condition. This can help improve symptoms of Gaucher's disease, such as tiredness, pain in the joints/bones, and a swollen liver or spleen. The usual daily dosage is determined by a healthcare professional, and it is best to take Miglustat capsule at the same time each day. Be sure to follow your doctor's instructions carefully. Before you start taking Miglustat, be sure to read the patient information leaflet provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. You should take this medication by mouth as directed by your doctor, usually 3 times a day. The dosage will depend on your medical condition and how you respond to the treatment. To get the most benefit from this medication, it's important to take it regularly. Try to take it at the same times each day to help you remember. If your condition doesn't improve or gets worse, be sure to inform your doctor. Some common side effects of Miglustat include nausea, vomiting, stomach pain, diarrhea, and weight loss. Your doctor may recommend taking Miglustat between meals or making changes to your diet to reduce diarrhea. They may also prescribe a medication to help with this. It's important to remember that the benefits of taking this medication outweigh the potential side effects for most people. However, you should contact your doctor if you experience any serious side effects such as numbness or weakness in the hands or feet, changes in vision, or severe allergic reactions. If you have any concerns about side effects, be sure to talk to your doctor or pharmacist for more information. Before taking Miglustat, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It's important to discuss this with your pharmacist for more information. Before using Miglustat, let your doctor or pharmacist know your medical history, especially if you have kidney disease, numbness/tingling in the hands or feet, or stomach/intestinal problems such as inflammatory bowel disease. Miglustat may cause dizziness, and this effect can be increased by alcohol or marijuana, cannabis. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. Limiting alcoholic beverages is also recommended. If you are using marijuana, cannabis, it's important to talk to your doctor. Before undergoing surgery, it's important to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, Miglustat should only be used when clearly needed, as it may harm an unborn baby. It's important to discuss the risks and benefits with your doctor. It is unknown if Miglustat passes into breast milk, and because of the potential risk to the infant, it is not recommended to breastfeed while using this medication. It's important to consult your doctor before breastfeeding. When taking Miglustat capsule, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the effectiveness and safety of your treatment. As always, consult your healthcare provider for personalized guidance. If someone has taken too much Miglustat capsule and is experiencing severe symptoms like losing consciousness or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can contact your local poison control center at 1-800-222-1222. In Canada, residents can reach out to their provincial poison control center for assistance. It's important not to share Miglustat capsules with others, as it is prescribed specifically for your condition. During your treatment with Miglustat capsules, your doctor may require you to undergo various medical tests to monitor your nerve function, kidney function, liver and spleen measurements, as well as a complete blood count including platelets. It's crucial to attend all scheduled medical and lab appointments and consult your doctor for more details. As for the daily dosage and optimal timing, your doctor will provide specific instructions based on your individual condition. Be sure to follow your doctor's recommendations carefully. If you forget to take a dose, just wait until your next scheduled dose. Don't take 2 doses at once to make up for the missed one. It is important to store Miglustat capsules at room temperature, away from light and moisture. Make sure to keep it out of the reach of children and pets. When it is expired or no longer needed, be sure to properly discard this product. You can consult your pharmacist or local waste disposal company for more information on how to do so. Avoid flushing medications down the toilet or pouring them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.